Okay, so he's come in, he's hurt himself playing football. He said his hamstrings were really tight for a little while prior. He played a game and then back just went, yeah?
Mm-hmm.
Yeah, okay, so he's been on crutches since. So he's not been weight bearing on that leg. And this happened, when was it? Saturday, so pretty much, which is almost a week ago. So you've not been doing any activity since that time?
No.
Okay, so let's see how you move. So I want you to, I know you're using the crunches, but as best as you can, just bend and try and touch your toes. Just go to move towards touching your toes as far as you can go. So just try and bend as far as you can. Okay, tell me what you feel happening.
A sharp pain.
Okay. Okay. Alright, so it looks like this all restricted. And you feel like you've got to keep the hamstrings bent as well. Can you straighten up the legs? It's too much, yeah?
It's too much.
Okay. Alright, I'll give you the crutches back in a second. But what we can see here, there's a bit of a rotation of his pelvis onto one side, and then I'm going to have to check his side ribs. Are you okay to lay down onto your back for me first of all? It's pretty sore, yeah?
Yeah.
It's more the active tissues then by the looks of it. Okay, so just nice and relaxed for me. Okay, and we're going to lift this leg up nice and straight. Okay, I'm coming up. Any pain or discomfort?
There.
Yeah, you feel it on that side when
this
I do
side,
it? Yeah, yeah. Okay, I'm going to bend the knee here. Just have a look at how we're moving here. Okay, okay, and we're going to come across here. So pretty much 10 out of 10 pain constantly, or is just...
Nah, just when you move it.
Just when you move it. Okay.
That's alright.
Okay, so this is good. Okay, let's have a look at this side. Lift this leg up. Okay,
There.
okay, when I do that, what are you feeling?
Pain.
Just pulling?
Sharp, yeah.
Yeah, you feeling it in the hammies as well?
No. It's just in the glutes.
Just in the glute. Okay. Right. You're good? Okay, bend the knee for me. Okay, here. That's okay?
Yeah. You have to be pushing.
Yeah. Okay, and coming across here.
Yeah, there.
That's what you feel. It's quite strong there?
Yeah.
Okay. Alright, let's get you laying onto your tummy. So what we're going to need to do, the first thing is obviously your pattern, and obviously you're doing everything now to avoid pain at the moment, but I want you to understand that that's going to cause more imbalance moving forward. Okay? So I'll talk you through it once I assess you and I've got more of an idea of what was happening. But right from the onset, we've got to stop that from happening. Otherwise you're going to get all knock-on effects and compensations of the way you're moving and how you're putting more pressure onto one side, and it's going to potentially make things a bit worse. Okay, and another important thing to note as well is that pain doesn't always, the severity of the pain doesn't always tell you the severity of the problem. Yeah, so it doesn't always mean that if something hurts a lot that it's really bad, and at the same time it doesn't mean just if something doesn't hurt as much, it doesn't mean that it's not that bad either way as well. Okay, so I'm pressing on the SI, it's not too uncomfortable. And this one's fine as well?
Yeah.
Okay. And when I'm pressing in here, that's where it's coming from? Here? Okay. And in here? That's really sore?
Yeah.
Yeah. Okay. So that feels like that's the piriformis deep in there. Okay, and then here, glute med. Okay. So what this is, according to what I can see, this is just a big spasm of the muscles of the hip, right? Particularly your piriformis muscle and your glute med. And that's probably, it is pulling your SIs across. And the thing is so the issue that you have is actually not that bad, right? Okay. So you're going to need to push yourself and move through. I know it's severe, but you're going to have to lose the crutches, you're going to have to start weight bearing on it straight away. Okay. And you're going to need to start trying to make sure that you balance yourself. You're going to have to take a deep breath and just slowly push yourself through stuff. I'm going to try and help loosen it up today, and I'm sure the techniques that we're going to do are going to help you, but it's going to be a bit of a process. But I want you to understand that to speed that process up, this concept is completely natural. I understand what you're doing, everyone will do that. Obviously you don't want to feel pain, but I want you to understand that you're going to have to kind of battle through that a little bit. Okay. Makes sense, yeah?
Yeah.
Okay. If you're using this and you're avoiding putting pressure, you're just allowing that spasm to, just get tighter. So even though it's going to hurt you, you're going to have to push through it, you're going to have to engage those muscles, you're going to have to use it. It's really severe pain, I can understand, like it's 10 out of 10 pain. But something which I just mentioned, just come down for me a bit, bro, just rest the head into the headpiece here. One thing I just explained is that whenever you have any sorts of issue, especially when it comes to musculoskeletal issues, the severity of pain doesn't always indicate the severity of the problem. So even though this is a severe spasm, he's been using crutches and stuff to prevent himself from kind of causing the pain and feeling that. But that in itself is actually making the issue worse because it's not allowing the muscles to engage. It's not putting any sensory input into the tissues. So even from the nervous system and the brain, there's going to be changes happening even within the short space of 1 week. Like within 3 days, you start getting muscle changes if you change the activities you're putting the tissue through. So that's going to potentially cause those muscles to become weaker. It's going to cause those muscles to become tighter, and it's also going to cause imbalances elsewhere in his body. So when I assessed him, I could see that there was a rotation of his hips. I could see that one side was higher than the other, and this was all because of the changes that he's made as a result of the pain and as a result of the adaptation to the pain. So this is something, whenever you have this sort of issue, one of the things you've got to get yourself through is that you have to push yourself through the pain. The pain is going to be there regardless, okay? So whether you push through it and then you deal with it there and then, or whether you avoid it and eventually, deal with the pain in, longer term, you're going to have to deal with it either way, okay? Okay, and what I'm using here is the handlebar of the instrument aided techniques, and I'm using what we call the fan method to apply a very, very strong amount of pressure right into the hip. I'm using the concavity of the tool, okay, and this is getting into the deep muscles and deep layers of this hip tissue, and he's got a lot of muscle here that we need to get through as well. But by using this method, I'm really putting limited exertion from myself. Okay, nice deep breaths in and out. Especially with a lot of manual therapists and practitioners, is that when someone's in severe pain, they actually become quite, how can you say, they don't have the confidence to work with them because they're worried that it's going to be something else and something more complicated. So getting in and working with them and using quite a lot of pressure like I am doing now is something that people will usually shy away from. Now I know what this is, so I'm confident to be able to treat him in this way. And this is, I guess, one of the reasons why a lot of people will avoid doing this sort of thing when someone's in such severe pain. But realistically, there's not a lot of harm that you're going to create by doing muscle work and things with people. And obviously it's important to understand their condition and understand what's wrong with them so that you're not making things worse. But more, 9 times out of 10, those people who are in a lot of pain, they usually need, they need muscle work, they need work done to them. So it's best not to shy away from things and at least give things a go. Because when you have a physical problem, a lot of the time you need a physical solution. Drugs and injections and all these sorts of things, the chemical solutions are not really going to cut it. And this is where I think it's grabbing you the most, yeah? Can you feel that lump right in there? Yeah. Deep breaths, try and relax the leg. Deep breaths. And like they say, right? More money, more problems. Same thing, more muscle, more problems. Yeah? The more muscle you've got, the more muscle issues you're gonna get. You've got to look after it. It's going to hurt more because the area is so sensitive. So when we grab onto the right muscle, you're just going to feel it pull. But the good thing about cupping is a little bit more nicer than the muscle work that I'm doing, because obviously it's like a gradual, as the suction comes on, you feel the muscle slowly pulling and just holds it. And then soon it kind of, as the muscle starts to release up, you won't really feel it as much in terms of the pull. Does that feel all right?
Yeah.
Basically, where the muscles of the hip are in spasm, you're going to have to pull it through that spasm and get those tissues moving again. Okay, so as you're doing, you need to just make sure you're going through all your movements, right? So anything that you would normally be doing, I want you to try and do it in terms of your day-to-day activities. You just have to make sure that you're pushing through it. You can take it slowly, but make sure you get that full range of movement. You taking painkillers today?
No, not today.
That's good. It's better that you don't when we do this kind of thing, just to get a good gauge of what's happening. Okay, and then just straight in. Okay. Earlier on when we were lifting up like this, you were feeling a lot more, right?
Yeah.
Yeah, so it's eased up a bit. Okay, push the knee down. Good. Okay, breathe. Deep breath. Okay, and we're just gonna move from here. So we're just gonna straighten here now. This way. Okay, and this is what I want you to do at home. Just basically lift the leg up, straight in the air, and then just drop it down on the side until you feel you're all pulling here. Can you feel that? I'm going to turn this way. Hold on to the elbows here and here. Okay, and I'm just going to give a little bit of a push into your spine now, just to adjust the joints just in here. Nice and loose for me. Little push. Good. Okay. All right, cool. I want you to sit up for me now. And even though you might still feel pain, you have to push through these movements. So I just want to check how you're moving. So sit for me nice and slowly. And let's get you bending down. Try and touch your toes and see how far you can go. Okay, breathe, push through it. So all that is because that's pulling, it's offsetting your SI joint, it's pulling on your SI joint, which is why you're feeling that. So what I want you to do is just, as you're doing right now, okay, as a routine at home, and just rest down and just try and stretch it and just gently just bounce and breathe in that position, okay? Okay. How's it feeling from when you first came in? Is it feeling a bit easier?
So much easier.
Yeah?
So much.
Like I said, pain isn't an indicator of how well this is functioning. It's basically how it feels and how you're moving and all these other factors. Okay. And the other thing is the big thing, because I know it's been quite severe, and even now when you're moving, I know you're like a bit wary with your movements because you're waiting for it to just kind of just grab you again, right? You're waiting for that severe pain to come back. But you've got to get through that. You've got to just breathe through that, and you've got to remind yourself that, you know what, this is all good. I just need to move through it. If you start moving confidently now through things, you're going to speed things up a lot. Okay. Yeah. So obviously it's quite sore today, so I wasn't able to push as much as we could. But yeah, we'll get you sorted now.